Welcome back. Today we are talking about a common yet often overlooked foot condition that affects millions of people. Of course, bunions. Dr. David Friscia, a board-certified orthopedic surgeon with Eisenhower Desert Orthopedic Center, is here to discuss a procedure that promises a more effective and lasting solution. So let's go from the basics. What is a bunion? How does it start?
Yes, bunions are very common. Bunions affect 25 to 35% of people, so very common. And a bunion is the prominence of the medial eminence, or the metatarsal head here. And it's actually not from the bone growing or a bump growing, but it's from instability of the foot, where this joint's loose and the foot widens.
Let me have you turn that toward the camera.
Yeah, the foot widens, and that accentuates your medial eminence. So again, the bone's not becoming crooked and bump's not growing, it's from an instability. And so over the years, there's and so they're not always painful. I mean, the initial treatment is wide shoe, wear comfortable shoes, open shoes, which fortunately we can do in the desert quite a bit.
Yeah.
But there's a newer procedure now that solves the cause of the bunion. In the past, there were, bunion surgery, you may have heard, kind of has a bad name. You've heard people that will tell you, foot surgery, never have it, or I had bunion surgery, it's horrible, or I have a friend who had this happen. And so you hear all these horror stories. But I think we finally come to realize that the cause of the bunion is, as these graphics show, is that it's instability, and that the Lapiplasty is a device and a procedure that we've developed that solves the source of the bunion, and so there's much less chance of recurrence and problems and easier recovery.
Interesting. So we're looking at, it looks like a device that helps. There's the compressor. What are we looking at exactly?
Yeah, you're looking at the plate stabilizing the joint. Basically, it's a technique that makes this reproducible, because you can see the crooked foot, and then we realign that joint that's causing instability, and then make the appropriate cuts, and then stabilize it with titanium plates. And that solves the cause of the bunion, rather than sometimes people do procedures around the toe that look good initially, but there's a high chance of recurrence and it coming back. And that's why you hear people sometimes say they had bunion surgery, but it came back, and things like that.
It sounds like narrow shoes, heels, this can often contribute.
Well, sometimes high heels and narrow shoes do contribute, but really it's the bunions. Most bunions are heredity causes them.
Oh,
so it's your family history. So people come in and say, yeah, my mother had bad bunions, my mother had horrible feet, and then their feet are trying to look the same, and so they want something done.
Right.
And a lot of people have it on both sides, and the gratifying thing of this procedure is that it's reproducible, the recovery's fairly rapid, and most people that have it on one side come back for the other side because they're satisfied.
Well, I think the recovery time, the shorter recovery time, is attractive for a lot of people, and sometimes it is what it is. If it's hereditary, you can't help it. And if you have questions, I think, go to Dr. Friscia. He knows all about it, and plenty of years of experience to help guide you through. Thank you so much for coming on and talking to us about Lapiplasty and possible solutions
Thank you.
for bunions in the future. All right.
Thanks.